Everybody. Tom Judd here, Global CE Day from CED. We've got Luis Fernandez from Mexico. Luis, so what the heck do? You do about 11 things, right?
Yeah, so I'm a little bit all over the place, but helping everybody, or at least I think I am. So I collaborate directly with the Mexican Society of Biomedical Engineering, helping out on the diffusion of communication of the events and anything, just contributing to my local society, first of all, and
All
big
right, so
shout.
number one, so me. Okay, keep going.
Okay. Well, second, I collaborate directly with CED as well, being part of the marketing and communications team, helping out on spreading the word about clinical engineering's value proposition.
He's the social media guru too.
And well, I have a small company of software development, and we build CMMS tools for clinical engineers in Latin America as well.
Entrepreneurial startup, 3.
And I guess that's it for today. Well, that's a little bit more than I can handle, definitely. But yeah.
But you're also a clinical engineer, particularly in the private health system in Mexico and
Indeed.
Chile, or
Yeah.
you know.
Well, yeah, I'm right now I'm helping the Mexican Consortium of Hospitals, which is a 44 group of private hospitals in Mexico, just building the centralized clinical engineering department to, do volume procurements, enhance safety, just save a ton of problems to the hospitals by coordinating 44 hospitals at the same time.
And Luis, I understand you're actually doing an innovation today. You're actually swimming in your office while you're doing this interview because of.
Yeah, I mean, I don't know what happened. I came here, in my car, just listening to Eye of the Tiger, really motivated to have this talk. And I just got here on a broken pipe within my office, and I'm just swimming around.
Sorry about that. So what has CED done in the last year to promote the CE profile around the world? Switching gears on you here.
Well, CED has done a lot. We've totally renovated a little bit the communication site here, or the strategy into promoting, good practices, good news, bad practices as well, so that we can learn from the stuff that doesn't work. And, just connecting with a lot of other societies of clinical engineering field. We've done webinars, we've done a website, we've done a hacking coronavirus update with daily, we check the sources onto the information that being said to this over 8,000 now collaborators. Then we have, just the webinars of this CE skills, knowledge, and everything. So I think we've done a lot on promoting, what are the skill sets that need to be developed, just shouting out to people that are, fighting this pandemic as the heroes of the clinical engineering field, and getting connected everyone with everybody so that they can learn from both the innovations, the good things, and the bad things from anybody else.
So Luis, I'm an old guy and you're the young guy. So you taught me these new letters this year, SEO. So how have we grown the worldwide community of clinical engineering?
So now it's over 18,000 people that have been subscribed to our monthly sendouts. We send important information about, what CED is doing worldwide, just connecting with other projects as well. Then we have our website, which has been enhanced on the search engine optimization strategies, which includes a little bit of code on the back end of the website, so that we can be found a little bit more on search engines such as Google, Yahoo, etc. And well, every blog post that we do also gets a little bit code on the backside, so that people just can find us a little bit more and know about CED and learn about other things that are happening around the world with this, not only with this pandemic, but also with the clinical engineering field in general.
So search engine optimization, SEO, is what you taught me. So, and I understand we've had, when we reported to the IFMBE Administrative Council last month, that we'd had in the last year 1.6 million touches.
Yeah.
Well, or some crazy number like that.
Yeah. Well, we've been all over the place. Fortunately, the formula that we have developed with the CED is working, and we've received over, over 1 million interactions over the past year. which has been a lot, not only just comments or likes or anything, but getting into actual people and getting them to engage in some way, either seeing our content, either commenting our content, downloading our content, etc. And this includes, all of our social media channels, such as Facebook, LinkedIn, Twitter, the Instagram as well. We have the website. We have also the webinars. We have a learning management system as well. So, we have plenty of reach, just to get into the newer generations, and also, every generation that uses a laptop or a mobile phone.
Well, Luis, you've given this incredible platform. A week ago on our daily calls now, Dr. Yadin David challenged CED to go out and talk to so many of our colleagues around the world in 10-minute interviews. And at the latest count, we're at 60 of those in the last week. So the platform you've helped create has really made a difference to touch individual lives, like you said. So what should we do in 2021? What's the vision from your perspective?
Technology will keep evolving. We are, experimenting more roles, more channels and more content regarding what we can do into getting the message. So I believe that 2020 was about creating our platform, getting it the few touches that it needed in order for it to explode, and it has exploded in a very good way. So next year will be all about getting into more people's, day to day, into getting into more maybe vinculations internationally, so that we can get more content of value, and just motivating everyone just to keep writing abstracts, keep writing blogs for, whatever they're doing. If they learn something, they need to write about it. They need to record themselves in a video, so that we can, as an association of societies, if I may say it that way, we just can centralize that information and keep a knowledge repository, so that everyone can learn from what everybody else is doing. And not only that, we have to also push the good practices into the body of practice, body of knowledge, get or reach the people that are experts or subject matter experts, for example, in adverse events, really specific niches of clinical engineering, in order for them to promote and produce more content that we can create. So it will be more about content creation and delivering that content and getting into a wider community of clinical engineers.
Well, Luis, we all know a great opportunity for that. It will be Orlando a year from now, late September 2021. Submit your abstracts, everybody, in the next couple weeks. Luis has helped us optimize that process. Luis, so that's one thought is, yeah, let's coalesce a lot of that best practice input for Orlando and people submit. The other is, this is about you personally. When you spent a year in Chile recently, you built a lot of relationships in clinical engineering and personally. We won't go there right now. But you brought Juan and Pablo to the table with me to talk about creating a society there in Chile. And they said, hey, we're really busy. We love our colleagues here in the country, in the public-private side of our country in clinical engineering. But, we don't know if we have time for that. And we said, don't worry, we're about, and this is you talking and me talking, we're about creating value, all this value that you've been talking about, SEO and social media and beyond, so that our colleagues in all these countries have all this information. They can use that to improve the profession, and it'll probably help them bring their people together as well. Your closing thoughts on that?
Well, Chile is an amazing country. It hosts a very good healthcare system in general, because it brings attention to the people in need. As well, in the private sector, we have, I think, which is at least one of the top 5 clinics in Latin America. It's a really amazing private hospital there. And there's a lot of professionals there. Unfortunately, there's not a lot of clinical engineering programs that can, just finish closing that hook into getting the management side really clear. But I think we're getting there. At least they have a couple of clinical engineers in the management part in the public healthcare system. So that's really good. And they're doing great. I think this pandemic, it's hard to everyone, and we may not know the answers to everything, but they're doing a really good job, I believe. And there's people that are really working their A off into producing the results that will push forward the country. So I believe that Chile will be a rising star in clinical engineering, because there's a lot of young professionals studying biomedical engineering, and through CED's connections, we will get the management side into the clinical engineering field there, so they can study a little bit more, maybe do workshops there next year, maybe do virtual conferences there next year, because there's a lot of professionals that would like to know how to handle things better in a sense of HTA, HTM, both. So I believe that they will be a rising star, and I have told them numerous times that there's a lot to be done everywhere, in Latin America in general. So in general, we will, I believe, just help building a great community there as well in other countries in Latin America.
So with that closing example, I'm just gonna make a couple of comments. Yes, Chile's on the rise, and a society will come, but there's many places around the world like that where we're helping create value for them and helping bring them together, and then the societies will come, as well as growing the existing societies. Thank you for your time, Luis, today. Stay out of that water if you can.
I will continue swimming.
All right. Thanks for now.
Thank you. Goodbye.
Bye.